Hi, my name is Genesis Diaz. The controversial topic that I chose to write about is cancer treatments and their effect on babies. My thesis statement was avoiding radiation therapy can prevent the baby from having birth defects, cancer, and perinatal outcomes. When choosing this topic, I didn't really focus on cancer and the variety of different types of cancers there are. I mainly focused on the treatment, specifically radiation therapy. There's a variety of different types of antibiotics, treatments, and drugs that are used for radiation therapy. One being thalidomide, which I use in my first body paragraph, which is about birth defects. Thalidomide is a drug or an antibiotic that's used for radiation therapy that has a direct cause of birth defects when being used on pregnant women. My second body paragraph is about cancer. I am not 100% sure if I'm going to use cancer as one of my reasons, because after doing a little bit more research about it, I concluded that radiation therapy itself doesn't really cause cancer, but instead it can not be strong. The treatment might not be strong enough to have the baby or to get rid of the cancer. After doing research, I found out that when there was a trial for it, which there was women that had cancer and were exposed to the treatment, and then there were women that didn't have or had cancer and weren't exposed to radiation therapy. The women that were exposed, their babies lived. They had a more percent of babies that lived without cancer. The ones that didn't have it, or the ones that weren't exposed to the radiation therapy, were their children had cancer or they didn't live. So I'm not sure if I want to use it or not, because there's not enough evidence that really says that radiation therapy itself causes cancer. My third body paragraph is about perinatal outcomes, which there's so many outcomes that can be there. There can be death, birth defects. This is just what can happen to the baby in general after treatments, anything. One of the piece of evidence that I use talks about how certain treatments, specifically radiation therapy and the antibiotics and equipment that they use, can affect your placenta, ovaries, uterus. When those things are affected negatively, it causes the baby not to get enough nutrients. Things happen where the baby lacks things that they need, which causes the baby to either be in a prenatal delivery or can cause a miscarriage. This topic interested me the most because this is the future. This is something that I want to study in the future. I want to be an OBGYN. I think everything about that type of stuff is very cool. And I would love to share it or find out what I learned and share it with other people. This is important. I think this is an important topic because there's a variety of things that people don't know about medicine and the medical field in general. I'm one of those people, which is why I chose this, and the outcomes I could have when taking treatments, especially on babies. So that's why I chose this topic. For the sources, I ended up using one more, therefore I have 4 sources. All of them were from the database, and they are obstetric and perinatal outcomes in survivors of childhood or adolescent cancer, adverse obstetric and perinatal outcomes following treatment of young adult cancer, risk in pregnancy, body and major radiognostic imaging in pregnancy, and risk of childhood malignancy.